Hi, welcome back. It's me again, the coding coach. So I am coming today so we can code more live charts. I got a lot of positive feedback. A lot of people enjoyed the videos, enjoyed the knowledge that was given, the tips and things like that. So I wanted to bring another video. So welcome. Don't forget to go ahead over from Instagram, click the link in the bio. Make sure you subscribe to the channel. Make sure you like if it helps you out. Comment, let me know what I can do better, or let me know if you enjoy the videos, what videos that you need to see. If you're studying for your CPC, let me know what subject that you're having a hard time with, and I can definitely make you some videos about that. If you just received your CPC certification, let me know the things that you're struggling with, the difference between what you learned in class and what you're learning on your job, which is totally different. So we're going to go ahead and code this live chart today. Like I said, don't forget to like, comment, and subscribe. Go ahead and leave Instagram once you're done. Click the link in the bio and subscribe. So what I am doing now is I'm entering the NPI, the National Provider Identification Number, because each provider that is seeing a patient, they should have an NPI. So I am finding this specific doctor's NPI number so I can add it to this chart. And I like this specific setup. You can't see it, of course, on my screen. I wouldn't show it anyway. It has confidential information. But I like this setup. There's a lot of, I've worked a lot of EMRs. I've also done EMR and training for physicians and hospital systems and things like that. And eClinical, I'm not doing an endorsement or anything, you know, eClinical can come and pay me, but it's not an endorsement. But Athena Health and eClinical, they have some great EMRs. You can navigate it good. I like how they do the setup of the charts. This one I'm specifically looking at is eClinical. I like the setup. So I'm entering the date of birth. The date of service. I'm saying date of birth. So I am entering the date of service for this patient. And it looks like this patient is coming in for a physical exam. So remember, in HCC, we're only going to capture the chronic conditions. So let's see what's going on with this patient. I'm live coding, as you guys know. So this is the first time I'm seeing this chart. We're reading it together. So it looks like a history of present illnesses. It looks like they did a depression screening for this patient. It's called the PHQ. And what they do is they give you a certain score. And depending on what your PHQ score is, they'll let the doctor know if you're depressed or if you're not depressed. And if you are depressed, what's your level or your classification of depression? Is it mild? Is it moderate? Is it severe? Is it with psychotic features? So they'll give you this PHQ test to see where you are as far as mentally in regards to depression or anxiety and things like that. So in the last 2 weeks, have you been bothered? The patient says little. So it says a lot of things about this patient. They're asking a lot of personal questions. They ask the question, you know, have you had thoughts that you'll be better off dead or hurting yourself in some kind of way? And the patient said not at all. So with the series of questions, they have a score of 6. So the doctor is saying that they have mild depression. So for beginners, beginning coding or coders, or if you have problems capturing everything in the codes, I'm going to show you a method as well. So another method, I'm going to read the chart as we'll go through it together. So I know now from the beginning that this patient already has mild depression is one of the diagnoses. And I know this is a HCC code. Of course, you may have to look it up if you're not used to HCC coding, but I know this is a HCC code, so I'll go ahead and write it down. So I know this patient has mild depression. That's the first thing I'm reading. So this is a 83-year-old male, presents for patient physical exam. His medical history includes depression, glucose intolerance. And a lot of times when you see glucose intolerance, they kind of use that for pre-diabetes. Of course, there's an ICD-10 code for pre-diabetes, but I wouldn't need to use it here. It's not an HCC code. It doesn't have a risk adjustment score, so it's just here. I don't need to worry about glucose intolerance. That's why I love HCC coding, because I don't have to capture every single code. So glucose intolerance, I don't need that. They have hypertension, so I know that has a risk adjustment score. They have hyperlipidemia, I know that is one. They have osteoporosis, that's one. Acid reflux or GERD, I know for sure that there's one. They have urge incontinence, I know that's not. Venous insufficiency, I'm not sure, I can't remember, but I'm thinking it is. I'm gonna write it down just to see so I can check with a question mark. They have history of colon cancer. Now, we talked about on a previous video about when and how to code cancer, and you only code the cancer when it's active. So by this chart or this physician writing, it's a history of colon cancer, that means the patient doesn't have it anymore. So, and then it also says after that, status post resection. So they mean that the person or this patient got their colon resectioned, so they got it out. So I don't have to worry about that. So let's see. And dysplasia with a Shatsky ring. Now I can't remember. I don't think the Shatsky ring ICD-10 code rafts to a risk adjustment score, but I'll write it down just in case. I don't think it does. I really don't code that code a lot. So he has been feeling well, except he has noticed not wanting to go out anymore. He has also had a panic attack that woke him from asleep. So I know he has panic attacks. So I'm gonna write that. I know the code is gonna be, I think it's F41.0. I think that's for panic attacks, panic disorder. And I'll look that up to be sure too. Okay, so moving on along. He said he came and saw Brett Forrett. That's another physician. But it had not changed the name, of course. But it hasn't recurred. So he hasn't had any more panic attacks. He had his veins evaluated by Dr. Jones, who felt he had venous insufficiency. You remember I wrote that down. I have to check and see if it's a HCC score for venous insufficiency. He cares for his disabled son, which is 48 years old. Okay, so annual wellness. He eats healthy, but he likes sweets. He is not exercising. He wears daily sunscreen. He does not get skin checks. He sees another doctor for eye exams. He has the urge incontinence that we talked about, wears a pad at night. He wears his seatbelts, has not fallen this year. And that's another thing they want to know about falls and things like that, because, we mentioned osteoporosis. And when you have osteoporosis, of course, your bones weak, and they tend to be, want to make sure that you're not falling and your bones is not getting weaker. So they always do kind of like a bone density check. So, and they always going to notate, like he has here, he has not fallen this year. It said he does not use DME for ambulation. That means he doesn't have any medical device equipment to help walk. Does his ADLs, that means activities of daily life or living every day, put on your clothes, your shoes, feed yourself, things like that. Okay. He declines further screening. Had a colon exam in 2012, things like that, blah, blah, blah. So here's the patient's chronic medical issues. Hypertension, he's on Norvasc. Osteoporosis, he's on Evista. GERD, omeprazole. He has hyperlipidemia, Zocor, depression, Remeron. So it's naming all the things that this person has and what they're doing for it. Anxiety, they're following it now. Insomnia, can't sleep. Venous insufficiency. It says he can't wear the hose like he's supposed to. So it looks like the doctor has also suggested that he wear hose. So it's going through the current medication. And if I did have a question about the cancer, if the cancer was still active, only thing I would do is go through the medications to see if the patient is taking any medications for cancer treatment, and they are not. So I'm looking at the surgical history. It says a colon resection. That's how they was able to get rid of the colon cancer. It said they had a right leg repair fracture. They had a tonsillectomy. They had vein stripping, and they also had cataract surgery. Now it's going through the family history. The father, he's deceased. He had liver disease, asthma, and other conditions. The mom is also deceased, had old age gastric ulcers, and diagnosed with other conditions. He has 2 deceased children, 1 deceased pneumonia with brain damage. He has a living daughter, has siblings, so they take all their history into account. Social history, no drinking, no drugging. Okay, so it lets me know all the major hospitalizations or major diagnostic procedures, not many. So now it's going to give me a review of systems, and if you're not familiar with that, the review of systems is when they review each one of your systems. So I'm looking here. They reviewed the cardiovascular, the respiratory, the gastroenterology, the musculoskeletal, the neurology, dermatology, endocrinology, hematology, ophthalmology, psychology. So they reviewed all of these systems. Not seeing anything significant. So I'm looking at the vitals. The BMI is not over 40. There's nothing for me to capture there. I'm looking at labs. Labs are also included in the encounters too. Now, we don't code from the labs, but the labs are usually here. So, bam, we're here to the assessment. So, this patient is going to have major depressive disorder with a single episode, and it's in partial remission. Now, a lot of these codes I know, so I'm going to go ahead and code. F32.4 is going to be that code. Osteoporosis with a fracture. Remember, they had a fracture previously. So, this is going to be M80.00, X as in xylophone. Is it an X? Yep. And A for initial encounter, of course. A is an apple. So when you have the A on the end, that means that's the first time this patient is being seen for this. So they had a fracture, obviously. So they have hypertension. I know that's I-10. Hyperlipidemia is not specified. Excuse me, so I know it's E78.5. They have other long-term drug therapies other drugs they take. It's not an HCC code. They have acid reflux, K21.9. I know that's HCC. Bilateral cataract, that's H26.9, but I don't need it because it's not an HCC. So venous insufficiency of both lower extremities. Now I think that's I87.2. Let's see, can't remember. That is it. Now it doesn't have a risk adjustment score because I have software here that lets me know if it's a HCC code or not. So it's not an HCC code, so I won't worry about coding that. That's the beauty of HCC coding. That's the beauty of it. I don't have to capture everything. So I don't have to capture that. Let's see about the Schatzki's ring. And that's spelled SCHATZKI, ring. That's a gastro disease. So let me type it in and see. And it does risk adjust. It's going to be K22.2. So insomnia is not a risk adjustment score. Your anxiety. Now sometimes anxiety does risk adjustment score. It depends on the level of anxiety. This is unspecified, so of course, nope, it doesn't have a score. Okay, so none of the rest of these things have a risk adjustment score. So we answered everything. I'm going over the preventative medicine, the counseling that the doctor wrote that they're going forward with this patient. Let's see, any procedure codes that were used, and that's it. So again, we've coded another HCC chart. Thank you for joining me. Don't forget to like, comment, and subscribe. And I have 1 minute left, so I want to give you this tip right quick. So whenever you're coding charts, if the patient is on dialysis, make sure you use Z99.2. If the patient has a G-tube, even if it's not documented that, hey, patient, if you see they have a G-tube status, they have a G-tube, always use Z93.1. Always use it. And if a diabetic patient is on insulin, make sure you always use Z79.4. Thanks for joining me, the coding coach. I'll see you later. Thanks.